All right, thank you for the kind intro. It's a pleasure being here. So yeah, we're going to talk about what I call Wearables 2.0, which is really at the intersection between the consumer space and the medical space. I'm Julien Penders. I'm co-founder and CEO of Bloom Technologies. Bloom is a digital startup based in San Francisco. Our mission is to improve the health of moms and babies through wearable tech and predictive analytics. To give you a little bit of background, so this whole idea started about 3 years ago when I had my first kid. And for all of you in the room here who have kids, it's clear that having a baby is one of the most beautiful things that can happen to you in life. The problem is that for many couples, this beautiful moment is hampered by problems, complications due to pregnancy complications. It's actually more common than we think. If we look at preterm birth being the birth of the baby before 37 weeks of gestational age, so before 37 weeks in the pregnancy, it affects 15 million of babies worldwide. And this is actually the #1 killer of children below the age of 5 worldwide. So it's a big problem. It's a big problem if we look at the pace of innovation in different areas. If we compare that to the pace of innovation in obstetrics, it's really alarming. In the last 40 years, there hasn't been any innovation in technology to help mothers monitor their baby as they're pregnant. So the vision of Bloom is that we need to change that. Moms deserve better, and we're here to change this. We're here to develop wearables that will help bring clinical-grade data in the hands of mothers with the convenience of an app and allowing comprehensive prenatal health management. So how did we get there? And so this talk is really about how did we decide and why did we decide to build a clinical-grade wearables tailored to pregnant moms? And I'd just like to share a bit of the story with you to give you a perspective of why we think it's important to combine clinical-grade in consumer form factors. So clearly, we are indeed in the midst of a wearable revolution. There are multiple devices out there used for multiple different types of applications. Consumers buy them. There are reports that shows, like in this case, that half of consumers will buy mobile health technologies for their health. The reasons may change. It could be to monitor fitness and well-being. We heard to talk about this a bit earlier today. It could be to allow physicians to remotely monitor their condition. It could be to continue monitoring a condition that they have, but 50% of the people will buy this. It's also interesting, a lot of people keep saying that doctors don't like that. It's actually not true. There's been surveys that shows that, in this case, 79% of doctors would say that they will use mobile devices, not to replace the diagnostics, but to help in the diagnostics. So there is also enthusiasm in the medical space. However, if we look at the state of the field nowadays, it's still stuck on early adopters. I think we haven't crossed the chasm yet. We're not yet in having like large adoption of those technologies. So why is that? What's going wrong with wearables that we could say wearables 1.0? There are a couple of reasons. The first thing is that wearables today provide very limited data. And again, we heard that earlier today. It's typically limited to activity, calories, expenditure. As some of the latest wearables will track also heart rate. But it's still very limited data that has limited value to the user. The second is accuracy. There was an interesting study about 2 years ago where someone compared 4 different wearables and looking at the calorie expenditure measured by those wearables. So you can see here, there's a lot of difference. So it's the same, it's wearing at the same time. There are a lot of difference in the output of those wearables, up to a factor of 8 times difference in this case, calorie expenditure. So it's really lacking accuracy. The third problem is failure to engage people. And it's a known fact now that most of the activity trackers purchased by people will end up in the drawer after 3 to 6 months. So that is a problem also. We'll get back to that. And the fourth problem is that people are questioning the medical value of these things. Even if wearables get adopted by many people, what do we do with this data from a medical perspective? Can we rely on this data to help people live a healthier life? So what about Wearables 2.0? How do we address those limitations? There are a couple of approaches that have been taken. The first one is go more into fashion. I think we heard the last 2 talks really talking about the intersection between wearables and fashion and how that will help to drive adoption of wearable technologies. I think that's one. Other people are looking at the workplace. It's wearables for corporate health. It's talking to and involving larger companies to actually drive the adoption of wearables. The third one is pharma. Some people believe that pharmas are going to be the ones that pick up wearables. At Bloom, we believe that the future of wearables is at the intersection of consumer and the medical space. And that's why we call medical wearables. There was a nice article by Fitbit also going into that direction. And just last week, we heard that some companies kind of in trouble right now are trying to refocus and pivot to something which brings more value to the consumer through clinical-grade wearables. So the core of it is to bring clinical-grade data into the consumer hands. So how do we do that? What are the steps that we need to take? First one is to go from limited data to more relevant and actionable information. We heard that word before. It's about getting to more data, but especially to better data and smaller data. So there are a few examples out there. I mean, there is this technology, this Scout from Scanadu, which is really trying to get more information about your health than just a tracker and trying to synthesize that information for you. I think this is a good example of something going in that direction. There are also smartwatches that are trying to go beyond just the activity tracker and pulse. This is an example by Samsung where they're trying to get an ECG into your watch. So again, we're bringing clinical value, clinical information into a consumer form factor. We need to go from big data to smaller data and eventually to action. And these are two examples from the space, like TickTrack is trying to summarize all your wearable data into one index that actually means something to you, and it's easy to act on. So if your index drops, you can have advice to work on your health and increase your index. There's an interesting company called Base Health, which is taking one step further. It's summarizing the information and provide you actions to actually improve your health status. The second thing is to go from limited accuracy to something which is accurate. And so this is something which is difficult because having accurate data means you need to validate your wearable against a reference system. And that takes time, that takes effort. But even the biggest companies starting doing this. There was a report news there on Apple, where Apple is setting up labs. So what you see here, these are calorimetry systems. So they're setting up clinical-grade labs to actually validate their technology. And this was in the context of the Apple Watch. So this is good. I mean, this shows that people who are pushing forward the wearable space are looking into validating the information they provide to consumer. And so that's really going to the next step. Short-lived engagement needs to transition to products that really address clear consumer needs. I think the problem with trackers is that they do not address a clear problem. And once you know how many steps you've worked every day, you kind of know it. It doesn't really address a core problem that you may have. So we need to shift to addressing specific problems, and that's going to require to focus on certain area. And I think if you look at the continuum of life, there are a lot of needs that evolve as you grow, right? The space we're in, it's around pregnancy and conception. There is clearly many questions that happen during that time. As you're growing up and as you're raising kids, there are also new questions that happen around, like, is my kid healthy? What can I do with my kid? And there are a few companies happening in that space. Then you get you get a bit older, and then you may need to live with a chronic condition. These are also niche, like diabetes. These are, well, not really niche, but they are specific problems that we can address and that really deliver values to people. And as you get to the end of life, you have everything related to elderly and independent living, which is also a very key problem. So there are key needs, key problems that can be addressed by wearables. It's just a matter of developing a wearable that addresses those specific needs. The last point is delivering clinical value. And there is no other way around than going through and embracing FDA. I think FDA is there to provide wearables a stamp of quality, a stamp of quality in the medical space. So I believe that digital health innovation, especially around wearables, will need to embrace FDA. And FDA is working towards simplifying the way for wearable companies to actually get an FDA stamp. But I think this is the only way to guarantee that the data we're collecting with a wearable eventually is of medical value, is of medical grade. All this, of course, has to happen also through revisiting the business strategy. So what does it take to develop a medical-grade wearable? It takes a lot of time and efforts. And for startups like we don't have the bandwidth, the resources, and the capital to actually go to FDA and develop everything up front. So we need to be creative in how we're going to launch our product and then grow towards this vision of a medical wearables. So the way we're doing it is that the first thing is to identify a consumer value prop. It's to identify a consumer product that you can solve. It's a specific needs that you can solve with your technology. It should be medical-grade technology, but that doesn't necessarily mean it has to be FDA approved. That is depending on the claims you're making. But the first step is to get into the consumer space and launch your product and get users. Through your users, then what you can do is crowdsource data. People are going to be using the product. They're going to use it because it has value for them, because it answers one of their needs. So they're going to be using the product. As they use the product, we're collecting data. As we're collecting data, we can gather early evidences of medical problem or medical value that the data has. And that is going to drive medical adoption to eventually get to the third step, which is to get FDA approval and integrate with healthcare systems, and eventually have a product that has a medical value proposition. There are a bunch of companies doing this. I think 23andMe was a great example a few years ago where they applied that in a genetic space. LifeCore is trying to do that also in the space of cardiac. Owlet is doing it in baby monitoring, and we're trying to do the same in the space of prenatal health. So what do? We focus on the first 1,000 days of life. This is an area of life which is very often forgotten. A lot of people focus on aging. We focus on the very first moment of life, from conception all the way to delivery. We've developed a sensor which is medical grade that tracks parameters of the mom and the baby throughout pregnancy. It starts with health of the mom, activity, stress, calorie expenditure, heart rate, cardiorespiratory fitness. It's enhanced by information about the baby, fetal movement, kick counts, and at the end, we also can measure the contractions and the fetal heart rate. So it's a comprehensive data set that we're collecting from mom and baby. We use this information to provide feedback to the mom, to provide peace of mind, and to help her understand what's happening during pregnancy, to help her understand if her baby is okay. At the same time, we're collecting data through the help of our users to crowdsource the largest and most comprehensive data set on prenatal health. Then we're using this data set with our predictive analytics to try to detect early indicators of pregnancy complications and help better manage complications. Of course, we can't do that alone, so we created partnerships. And we set up partnerships with the UCSF Preterm Birth Initiative, where we are looking at using our technology to understand the early indicators for preterm birth. So that's what we do. I'd like to thank you for your attention, and I'm happy to take any questions if there are any.
Any questions? I'm wondering if there are any mothers that are hesitant to use this because of the radiations. Like, I know that the security and radiation is always like a big concern with mothers.
It's a very good question. So yeah, we sometimes have the question. The technology is totally passive. So the way we designed it, if you compare like to ultrasound, where you have like energy being beamed in the body, ours is totally passive. So we listen basically electrically and we measure motion at the surface of the belly, but there is nothing that really goes in the belly. So we've designed the system as such, so it's totally safe for continuous use, which is the tricky part. Yeah, it's a good question.
How long until you have enough data that you're able to predict?
So today we're not at the stage yet where we predict. So today we're collecting data to be able to predict certain pregnancy complications. So it's a bit too early to answer, but typically, depending on what you want to measure, we see that in the last trimester, the data is already very relevant. We see early signs, but it's too early to conclude yet. Yeah.
And is it very expensive, the product?
So today we're renting it, so it's available for it's a subscription. It goes for $29 a week. And mom can use it when they want. So some rent it like the 4 last months of pregnancy, some will rent it only the last month. So that's totally open. Yeah.
Any other questions?
Yeah. So how do you think about kind of the go-to-market strategy? Because a lot of the Penders stuff, they're direct to consumers, but since you're going more corporate way, do you work with hospitals, clinics, or how do you guys go to market?
Yeah, it's a good question. So our idea and the new paradigm is to go to consumer first. So our first strategy, our first go-to-market is B2C, direct to consumer. Then when you do that, you will gather the evidences that you need to convince healthcare providers or healthcare payers. So we B2C in the first place, and it will move to more like something B2B or B2B2C in a second stage. Yeah.
Do you guys work with insurance providers to get some of the subsidized? Or?
Yeah, so we're in discussion with some insurance providers for sure. I think they're definitely a possible partner for the second stage. You're going to have to show them evidences that this can either like reduce healthcare utilization or reduce the risk of certain pregnancy complications. So once you have those evidences, and again, so you're gathering them through a consumer product. Once you get those evidences, then you can go to them and then start having them to reimburse the product. Yeah. Yep.
I was impressed with your knowledge of the space in general. Do you know anything of like what you're working on that works for people just post-surgery, just after surgery, after they leave the hospital?
To measure like rehab, like state?
Like a lot of people go back, 40-something% go back into the hospital within 90 days after coming out.
Yeah.
Measures that period.
I know there are some things for COPD in particular. I guess it depends a bit of the, but that's not really a surgery. It's a disease in particular. I don't know about rehabilitation for home, at least. I know some companies that are developing technology that helps you track how you recover through training and provide you feedback on your performance, but that's going to be in the rehab setting, not at home. So I wouldn't, no, I don't know any other companies that do that from home. Yeah. Yep.
All right, thank you so
All right,
much,
thank
Julien.
you.